Okay, so hi everyone, my name's Kate and I'm a researcher working at the University of Exeter, and I'm excited to be here today to talk to you about a research project we conducted as part of the Violence, Abuse and Mental Health Network funding. The project is called Intervention Components that Have Common Impacts Across Parental Domestic Violence and Abuse, Mental Ill Health and Substance Misuse. So before I go on and tell you about what we did, it's important I mention the project team. In addition to myself, the team included Professor Vashti Berry, Professor GJ Melendez-Torres, Tamana Malhotra, a research assistant we employed as part of the funding, Amy Bond and Alice Garoud. So what's the problem? Parental domestic violence and abuse, mental ill health and substance misuse are public health problems that are prevalent, detrimental to parents and children, and often co-occur. Despite this, these issues are largely addressed in silos by separate services and commissioners. Families experiencing all three of these issues are likely to be particularly vulnerable. In light of this, recent UK reports have emphasised the need for more interdisciplinary working between services targeting these issues, and this has led to changes in the ways in which some local authorities are commissioning services, aiming to address multiple needs rather than singular issues. However, although our policy and practice colleagues are making strides to support families with co-occurring needs, it's not clear how we should do this, with there being a lack of evidence-based guidance on which interventions might prevent and tackle these co-occurring issues in combination. So to address this gap, we recently conducted a systematic review, examining family-focused interventions that have combined impacts on these three outcomes. Of the 37 studies we identified, only one had combined impacts on two or more outcomes, leading us to conclude there was a distinct lack of evidence for and no best bet interventions that we could use in this space. Our current project builds on this review to identify whether there are any key intervention components that have common positive or negative impacts across these issues. And this will help us identify which aspects of support are more or less helpful and guide the development of future interventions. So what did we do? We conducted a search for randomised controlled trials of family-focused interventions. Studies had to include parents or carers at risk of or experiencing one or more of domestic violence and abuse, mental ill health and or substance misuse. And studies had to measure at least one of these outcomes. Using all of the studies we found, we then conducted an intervention components analysis, and this involves two main stages. Firstly, developing an understanding of the differences between interventions, and secondly, using this information to assess differences in outcomes. Practically, what this involved is our team going through each study intervention description and coding the intervention components that were present. We met regularly to discuss our coding, and we then calculated effect sizes for each intervention so we could see whether it had been effective in improving outcomes. So what did we find? In total, we extracted information on 164 interventions. 40 of these interventions targeted two or more of the outcomes we were interested in, and I call these clustered interventions. 14 targeted domestic violence and abuse, 71 targeted mental health, and 39 targeted substance misuse. Examining all of these interventions, we identified 20 components that seemed to tell us something about how interventions were aiming to improve outcomes. I'm not going to go into detail on all of these. You can see some of them on the screen here, but there are several key findings that I wanted to point out. So firstly, most interventions used some kind of skills enhancement as a driving behaviour change mechanism. Over half of all interventions aim to increase parenting skills, which is perhaps unsurprising given these are family-focused interventions. But this component was particularly prevalent in mental health interventions and clustered interventions. Psychoeducation was also a common component across interventions. The knowledge shared was largely focused on the target issue, so mental health interventions provided some kind of mental health psychoeducation, but not exclusively. For example, a small number of substance misuse interventions provided psychoeducation on mental health and domestic violence and abuse. Developing healthy relationships was also a common component across interventions, and particularly in clustered interventions. Most interventions focused on the parent-child relationship, except for domestic violence and abuse interventions, which focused on interparental relationships more commonly. Interestingly, there were no issue-specific components, but certain components were more relevant to particular issues. For example, empowerment was important for domestic violence and abuse interventions, changing cognitive processes for mental health interventions, and managing symptoms and relapse prevention for substance misuse interventions. For clustered interventions, addressing additional needs, promoting health-related behaviours and development, and providing post-intervention or long-term support were all particularly prevalent components. When thinking about our effect sizes, what we found here was that most single-issue interventions were not successful in improving outcomes. And interestingly, interventions targeting multiple outcomes didn't do any better. In fact, our meta-regression suggests that clustered interventions may have been unhelpful for mental health outcomes. Meta-regressions also revealed that there were no singularly or commonly effective components. So most studies produced null effects, however, a small number demonstrated significant negative effects on target outcomes. But differences in study design and population prevent us from drawing any strong conclusions here. So in conclusion, we didn't find any evidence for the success of intervention components. Many components were kind of common across issues and similarly ineffective. And it's likely that interventions responding to families with multiple needs require designs that consider both the context and mechanisms of clustered risk.